In H.R. 3200, America's Affordable Health Choices Act of 2009, there is a section that is called Home Visitation Programs for Families with Young Children and Families Expecting Children. This is Section 404. There are several problems with this section that would allow for minor and major indoctrination efforts of unknown child-raising methods. States could enact legislation that requires enrollment in the federal home visitations to qualify for access to state programs of any kind. The type of education is not specified. If you don't do as the well-trained and competent staff require, you could be penalized. The funding increases by $50 million yearly, allowing for the growth of the number of home visitation child education experts, possibly until every family has their very own indoctrination specialist. States can apply for the grants so long as they meet the requirements, one of which is the number, quality, and capacity of home visitation programs for families with young children and families expecting children in the state. Once the state begins the programs, to renew their grants or to increase their program size, they will need to increase the number of families in the program. States can enact requirements in any other programs that they have that would require enrollment in the home child rearing education to qualify for access to the other programs, like food stamps, cash assistance, public housing, public schooling. This would keep enrollment in the voluntary home child rearing education visit program growing so that the state can continue to apply for more and more of the grants and swell the number of experts to visit homes. The type of child rearing education these experts will teach isn't specified. They could be teaching any number of methods. You may or may not agree with how they want you to raise your child. They can require how you punish a misbehaving child or how you reward a child who excels. They can indoctrinate your child with ideological points of view you do not agree with. If you don't do as the well-trained and competent staff require, you could be penalized. Charges of child neglect could be brought if you do not agree with the methods of principles they are teaching. Then you have to try to defend your ability to parent in front of a judge. And if you fail to prove your case, your children are taken away by the state. To start with, $50 million is available the first year, and an additional funding increase of $50 million yearly. That would be $100 million the second year, $150 million the third year, on and on. This would allow for the growth of the number of home visitation child education experts, possibly until every family has their very own indoctrination specialist. Imagine how many specialists the program will have after 5 years, and it is spending $250 million a year and growing and growing. To keep those experts employed and enough families being visited, the government option for health care could one day require enrollment in home child rearing education visits. This would be part of the long-term strategy of the progressives to control you and imbue your children into their ideology. One day, an Obamabot will be visiting you in your home to tell you how to raise your child and teaching your child how to snitch on you, their parent, if you don't do as the Obamabots require.